50 more COVID-19 cases, mostly in the densely populated Greater Seoul area. The resurgence threatens to erase some of the hard-won gains in the battle against the virus. The KCDC is on high alert as 1 in 4 new patients last week have been aged 65 and above. Yoon Jung-min has our top story.
South Korea is seeing a spike in new COVID-19 cases centered around the capital Seoul and its surrounding Gyeonggi-do Province. On Wednesday, the country reported 50 new cases. Of the new cases, 12 were in Seoul, 21 in Gyeonggi-do Province, and 8 in Incheon. The total cases now stand at 11,902, while there were 2 more fatalities, bringing the total to 276.
New local transmissions in the capital area are reaching 30 to 50 every day. In particular, there are sporadic chain infections at vulnerable places and small gatherings. We're currently checking whether they're following quarantine rules.
During the past week, the situation in Seoul has gotten worse due to a number of cluster infections at a local door-to-door sales company, sports facilities, and churches. The daily average of new infections in Seoul has been around 20 since last Sunday, and the number of patients under quarantine in the capital was 359 as of Wednesday morning. The city had already experienced a spike in number of people under quarantine during March and April, mostly due to imported cases. The numbers have begun climbing up again from late May, this time mostly because of community transmissions.
It's best not to go to those places right now to stop the chain infection. If you go to churches or other public places, wearing a mask is a must. Also, keeping at least a 1 meter distance can lower the risk of infection by 85%.
The authorities say there are concerns about an increasing number of infections among the elderly, with more than 1 out of 4 patients found to be elderly people.
As of late, the number of patients above 65 years old has sharply jumped to 26.6%, and there's an increasing proportion of the elderly in the cluster infections.
Health authorities are also closely monitoring some cases of which the source of infection has been difficult to track down. Yoon Jung-min, Arirang News.